Good morning, friends. Welcome to the India's biggest weight loss challenge. I'm so happy today to we have a special guest, Dr. Nand Kishore Duggapati, and we have done a lot of seminars and on with the special experts in different fields. So I'll request Professor Adrian Kennedy to share his profile so that everybody can see.
Thank you. Thank you, Coach Nadeem. Thank you. Thank you so much. Friends, Dr. Nadeem was right when he said we have a very special guest. But guest would not be the right word to use. Dr. Nand Kishore is in fact the convener, the soul behind the weight loss challenge in India. But I will come to that later. My job today is to introduce Dr. Nand Kishore and to ask him a few questions at the end of today's webinar. Now, Dr. Nand Kishore returned to India after spending time in the US in order to serve this country. And it's a remarkable journey. And I got connected with Dr. Nand Kishore not more than a month or two back, perhaps 3 months, when he was the main anchor, the instrument, the soul of the weight loss challenge, which is now happening at this moment. We have over 200,000 hits on our social media, more than 2,000 registrations of individuals who are overweight and obese. Now, Dr. Nand Kishore has more medical qualifications than can fit on a sheet of paper. So I will simply say that Dr. Nand Kishore, to the best of my knowledge, has done his MD, DABS, and there are many letters, FAS, MBS, and many other such certifications. And obviously, Dr. Nand Kishore is a very learned individual. He is the clinical director and chief surgeon of one of the largest hospitals in Hyderabad and perhaps in India, KIMS. He is the clinical director and chief surgeon of KIMS LivLife. It's a combination of two institutions. But as I mentioned earlier, Dr. Nand Kishore studied surgery in Cornell. I'm sure his father is very proud. Cornell University is one of the leading institutions in the world, and that is representative of our speaker today. He did his fellowship in Texas. He did more than his fellowship. He did, as I understand it, perhaps 2 fellowships, bariatric surgery and gastrointestinal surgery. Well, you know, it's interesting. Dr. Nand Kishore is the president-elect of the Obesity Society of India. And if you look up the Obesity Society, you will find that they have probably 400 hospitals associated with them and more than 600 bariatric surgeons. And he, of course, is a member of the Medical Council of India. 5,000 bariatric surgeries and 10,000 laparoscopic surgeries. Naturally, he is an opinion leader for the future of managing obesity. So he advises and associates with international organizations like Eli Lilly and Novodisc. Forgive my lack of acquaintance with these details, but I do know that they are leading international multinationals. And as I said before, Dr. Nand Kishore returned to India and opened his own hospital his own hospital, LivLife. And I've had the great pleasure of meeting Dr. Nand Kishore there. Ladies and gentlemen, Dr. Nand Kishore, it was his energy that created the weight loss challenge, of which we have more than 200,000 hits and more than 2,000 registrations. And we will shortly be having our award function. May I invite Dr. Nand Kishore to give us of his wisdom with a few slides. Thank you, sir.
Thank you, Professor Kennedy and Dr. Nadeem ji. So thank you very much for that wonderful introduction. I really appreciate that. You've been very kind to me on that. And I congratulate all the participants of India's biggest weight loss challenge. By participating alone, you have taken a wonderful step forward. That in itself makes you a winner. And we're looking forward to this amazing event where we get to appreciate and celebrate your success with the final program, which will happen soon. And we will be able to announce the final winners of various segments in this weight loss challenge. So today, without further ado, I'd like to speak with you on the major epidemic that is happening in the world, which is obesity. Obesity has global impact. It is a pandemic of this modern society. It no longer is a lifestyle condition. It is now recognized as a disease which is the main cause for several other conditions. So I'd like to share some of that information with you. While there are many global threats, we have had global warming, we had bird flu, we had COVID-19, but all of those don't even come anywhere close to what the kind of threat obesity poses to our entire global society. Because obesity can cause multiple subsequent health conditions. As the picture shows you here, an obese person is highly prone to sleep apnea, which is snoring. The reason why snoring is important is because it is also known as obesity hypoventilation syndrome, which leads to a lot of impact on adverse effect on your heart, your blood pressure, which can lead to further down the road, heart disease, stroke, and also lead to metabolic syndrome, which can cause hypertension, type 2 diabetes, etc. Having high body fat composition is a major risk factor because it involves our abdominal organs, leads to metabolic syndrome, thereby can actually make you prone to malignancies, which are cancers like colon cancer, in women, uterine breast cancer, pancreatic cancer. Many cancers are possible just by being obese. Also, the weight-bearing joints like knee joints and the hip joints, etc., they get worn out very quickly, which is called osteoarthritis. These are the people they run around to get knee replacements, hip replacements, etc. But all this can be preventable. If obesity in itself is taken care of, all the subsequent health conditions can be managed or prevented. So when you look at this, obesity and its connection with heart disease, a person who's obese and remains obese for say for 10 years, their risk of having heart damage is more than 1.25 times increased. At the same time, as the age advances, person remains obese, the risk with advancing age of having a heart disease also increases. Like at the age of 40, it's 2.4 times more than a normal individual. Once you reach 50, it's almost 3 times more than a regular individual, meaning an obese person has 3 times more risk of having heart disease by the age of 50 compared to a normal individual. Now, when you look at body weight and the type 2 diabetes, the purple color is women and the green color is men, but the bottom is the body mass index. What is body mass index? Based on a person's height and weight, we calculate a number called body mass index. Normal body mass index is 18 to 23 for Indians. Above 23 is considered overweight, and above 25 is considered to be obese with the latest standards and classifications. If you look at the body mass index 33 onwards, you can see that there's a steep increase in the risk of type 2 diabetes in both men and women tend to be at a higher risk. So being overweight makes you prone to pick up type 2 diabetes. If you look at various countries in the world, India ranks pretty high in total number of diabetic patients. Not only that, going down the road, in future predictions also, India tends to remain as the potentially highest ranked country to have largest obese suffering, the diabetes suffering population. Now, for young ladies, most of the people who are in the software and various BPO employees, etc., who are struggling with obesity, they also have various issues like menstrual irregularities, polycystic ovarian disease, and thereby having infertility. Remember this, the chances of pregnancy will be reduced by almost 5% for every BMI unit that you are above 29. Let us say if your body mass index is 30, that means your risk, or rather your chance of conceiving naturally, is going to drop down by 5%. So it goes on to say that if a person manages their excess weight and body obesity, etc., their menstrual cycles, PCOD, everything gets under control. Thereby, you'll be able to conceive naturally and have a very healthy pregnancy and a happy baby. This is something we notice very frequently. If you look around in some of your colleagues, your friends, families, you will see this. There's the darkness on the face, on the cheek or the forehead. This is called acanthosis nigricans. Also, you will see this maybe in young ladies also. There's a lot of facial hair, there's a pimples on the face. This is called hirsutism. All these things suggest hormonal imbalance because of obesity. And acanthosis nigricans also suggests that there is a substantial insulin resistance in the body, which means that particular individual is highly prone to type 2 diabetes. This is what we're talking about, obstructive sleep apnea. We have people who snore at night very loudly, wherein the partners are complaining, friends, family, everybody's complaining, saying that it's like, very loud in the night. So these people, they tend not to get enough oxygen during the sleep. So they're sleeping and they're snoring. So the oxygen concentration in their body drops down substantially. That's where they have a higher risk of picking up the heart diseases or strokes, etc. Those are the kind of people, when they're obese, they tend to be on these machines called CPAP machine, BiPAP machine, to be able to sleep and breathe better during the sleep. Another next major issue is, because of obesity, is the joint issues, osteoarthritis. Now, we know that when you lose weight, your joints thank you. They say, thank you very much. All that excess load is taken away from me. Let us say a 5 foot 10 inch person who is supposed to be around 70, 72 kilos, but they're now 120 kilos, for example. That means they're carrying about 50 kilos of excess weight on that joints, which are made only for 70 kilos. So those joints tend to get worn out very quickly, right? So 2 out of every 3 adults with arthritis are either overweight or have obesity in our country. Okay. Patients, they need to be advised appropriately, saying that less than half of the adults who are suffering with arthritis, who are having obesity or overweight, when they lose weight, there is a substantial benefit to their joints. Okay, they're 4 times more likely to, when they start seeing the weight loss benefits, they're 4 times more likely to be more proactive and try to lose weight also. So long story short is that as you lose weight, your joints will get better, the impact on the joints will reduce, and they tend to last much, much longer. So thereby one can avoid future surgeries like knee replacements, hip replacements, etc. So looking at the cancers, esophageal cancer, that is food pipe cancer, breast cancer, gallbladder, liver, pancreas, kidney, intestine, uterine, all these organs are prone to picking up cancers if you're obese. Okay, these are the top 10 cancers that are possible in the obese population. The interesting point is that out of the most preventable causes of cancer, number 1 is smoking. So if you do not smoke, naturally you will avoid a lot of lung cancers, etc. The number 2 on the list is obesity. So almost 7 to 10% of cancers in the world, meaning there are millions of cases who are having various kinds of cancers, of which 10% is because of obesity, 7 to 10% is because of obesity, that can be prevented, okay, just by taking care of that excess weight. Not only all these things, it also creates a lot of psychological impact on the patients or the person when they're obese. Meaning the depression by gender and BMI. Look, you can look at this chart here. The red colored graph is for men, blue is for women. As the body mass index increases, as the weight increases, the rates of depression also substantially increase. Once the body mass index crosses 35 to 39, there is a huge increase in the incidence of depression, because these are the people, they're not happy with the way they look, they're unhappy that they're unable to do anything about it, they can't control their eating habits, they are not able to get out there and start exercising, they become a social recluse. They want to stay at home, be on the social media, watch maybe television, and be on their laptops, etc. But they'll avoid any public contact like parties or weddings or functions, etc., because they don't want to be seen the way they are appearing. So that contributes to a lot of depression. Now, one of the biggest things, and which is closest to my heart, is our children, our next generation. We are very easily letting our children be on the screens, like whether it's a mobile phone or it's a TV or it's a laptop, just to keep them occupied, and then so that you're able to do whatever that you wish to do. And the kids are becoming very addicted to this particular screen time. You should know that India has the second highest number of obese children in the world. Second highest. That's a lot of children. Although many people think India is malnourished, poorly nourished, poor, there's not enough food. But believe me, we rank highest or the second highest in the world of having obese children. All this is because of lack of physical activity, lack of food control or proper nutritious food. And these children tend not to be very successful in their academic performance. And there's a positive correlation between childhood obesity and early onset puberty. If you look at young children, young girls, you also see their sexual changes, the secondary sexual characteristics very quickly because of the higher hormone influence. Okay, all this leads to several psychological effects on these children. One is negative self-concept, lack of self-esteem, lack of self-confidence. They get teased and annoyed by their colleagues, peers, the fellow students, and they become lonely and they isolate themselves socially. There's a lot of social discrimination. When an obese person comes in for a job or for a promotion, it's a known fact that they don't stand a very good chance of getting that job or getting that promotion, because a lot of times there's a foregone conclusion that a lot of people think, okay, this person is obese, so they're lazy, they may not be so productive. Okay, it's a outright conclusion that most people have. All this leads to substantial depression in this population. Now, causes of childhood obesity, definitely inappropriate food habits. They eat all sorts of junk and not healthy food, and increased screen time. That is, as parents, we have to be very, very cautious about that. And reduce physical activity. With the modern society, there are hardly any playgrounds, and people don't have the means or the time or the resources to put the children on structured physical activity programs. And last but not the least is the stressed out and busy parents. Both parents are working morning till evening. You come home, you're tired. You don't have that kind of a specific time to engage the children, to take them out for some physical activity, play sports, etc. More often than not, you reward the children with some fast food, junk food, order some pizza, let them watch TV, or on the weekends you just take them out to eat at some nice restaurant. So everything is around food and not so much on the physical activity and physical fitness. All these things are leading to childhood obesity. As the joke goes, a person they'll try everything that makes you fat, like, getting on the weighing scale, looking at yourself in the mirror or in the photographs, etc. But what you should do is try to do something that actually works. Okay, let's talk about what are the things that actually work for us. Guided diet programs, regular physical activity, weight loss medications, and bariatric procedures. This is what the science has to offer today. Okay. The guided diet program, we have a specific program called anti-inflammatory diet, which is a 3-month program that can help people substantially to get rid of their excess body weight, also to identify that food materials that their body is reacting adversely to, which is we call them inflammatory food materials. Once you identify them and isolate them, person tends to maintain their ideal body weight very well, and they tend to remain very healthy. Having regular physical activity, Coach Nadeem is a big proponent of that, and he has many centers that he supports just to promote appropriate and proper physical activity, and you can always seek his guidance on that. Now, coming to weight loss medications, let's talk a little bit more. Before that, I would like to emphasize on a couple of points. We all go to the grocery store to purchase food. We have options. We have the option on the left, which is your fresh fruits, fresh produce, vegetables, green leaves, etc., etc. On the right flip side, you have all the processed food, simple carbs, cookies, chips, etc. So it's very easy to find that comfort food like chips and crackers and cookies, etc., and not dwell into the healthy food material. So it's very important to make those right choices when you go to these kind of places when you're picking up food material. Now, there's a lot of protein sources one should concentrate on. You have the eggs, you have the meat, etc. for non-vegetarians. For vegetarians, you have pulses, you have the legumes, etc., which can give you adequate amount of protein. When all else fails, you also can consider taking adequate protein. So taking substantial amount of protein, small mid-level of carbohydrates, and low fat. Should be the formula, because the protein gives you around 3.5 calories per gram consumed. Carbohydrate gives you 4 calories, whereas fat gives you 9 calories per every gram consumed. So instead of 1 gram of fat, you can consume almost 3 grams of protein, meaning if you want to eat a large quantity of food, you go to the highly proteinaceous food, you can actually eat a good filling meal, but yet don't pick up unnecessary calories. Also, exercise. Having proper structured exercise is very important. You don't need to actually go to a gym or have to have a membership or spend all that money on that, but you can set up within your own place. Get a nice yoga mat, get a Pilates ball, yoga ball, do a lot of calisthenics, body weight based exercises. There are a lot of resources. Coaches like Nadeem can offer you wonderful resources how to exercise and guidance, etc. Also in YouTube and many other public resources, there's a lot of exercises, videos, everything is published. So utilize those resources and try to put in at least 25 to 30 minutes per day. That in itself will guarantee you a wonderful health and longevity. So when all else fails, and then people are looking at these kind of options, which are the weight loss injections and medications that came in recently. The first one that came into market is called semaglutide, which is manufactured by Novo Nordisk company. And essentially, they have two names, which is Wegovy and one is Ozempic. Both are injectable medications. You can take it once a week. The same medication is available as a tablet, which is called Rybelsus, which is taken daily. You can expect about 10 to 15% of body weight loss. Now, how do they work? The semaglutide is known as a GLP-1 receptor agonist. Basically, they work by reducing your hunger. They reduce your hunger, they increase your insulin secretion, and also they reduce the stomach emptying. When you eat your food, the food stays in the stomach longer, so it keeps you full longer. Okay, but sometimes some people can experience certain side effects like nausea, vomiting, some cramping in the tummy, etc., some loose motions, etc. But they are not very common. Rare situations are like pancreatitis and thyroid cancers, etc. They're extremely rare. So the next one is tirzepatide. This is manufactured by Eli Lilly company. The trade name is Mounjaro. It's available in various doses, 2.5, 5, 10, and 15 milligrams also is available. It can give you 15 to 25% of body weight loss, depending on the dose, because the dose needs to be increased as the time progresses to get the excess weight loss to be achieved. Okay. But important thing is that all these medications will only work as long as you use them. The moment you stop using them, the effect of the medication is gone, and you will have to maintain that weight loss. If you do not maintain, then you tend to regain all that lost weight and some more. There's a potential for that. I'm not saying everybody will, but some may. So we also are being reported, some reports came through some of the patients who have taken or utilized these medications, is that once they have stopped using these medicines, there is an increased carbohydrate craving and craving for sweets, etc. So one needs to be more careful in not indulging in such food habits. So the way tirzepatide works is that it's a combination of GLP-1 and GIP. So it has two hormones, works in two different mechanisms, also reduces your hunger. If side effects are not as bad, and the risk of pancreatitis exists, but also gives you, all these medications give you adequate weight loss. When someone is looking for a long-term relief from obesity and also have lasting results, and they want to take care of themselves for the next any number of years, then we should look at the long-lasting procedures, because all the medications, etc., are temporary. You cannot use them for the rest of your life, right? It's not practical. What do we have today in bariatric procedures is that one is endoscopic procedures, which is a gastric balloon. Gastric balloon is done endoscopically. Through the mouth, we place a camera, your person will be sleeping, and we place a balloon inside the tummy, and then we'll fill it up, right? So once I'll show you that. Here is the gastric balloon. So once the balloon is put in the stomach, the pink one is the stomach, and the middle, you can see the balloon in the middle. It occupies most of the space. So small quantity of food, once you consume, it makes you feel very full. So these balloons are available in 3 months, 6 months, and 1 year model. Most of the times we prefer 1 year models because they give you better results. People can expect 3 to 4 days of nausea and vomiting with such procedures. It's about a 15-minute procedure, daycare process. One can get back to work within a couple of days. Now, sleeve gastrectomy. This is a surgical procedure, meaning laparoscopic, tiny skin cuts through which we place pencils like cameras. Typically, it's a very painless procedure, 1 to 2 days of hospital stay. What do we do in this procedure? When you see the large stomach inside, based on the amount of weight loss a person is looking for, we reduce the size of the stomach vertically. When we do that, we remove a large portion of the stomach capacity. So thereby, a person can eat a small quantity of food and feel very full, okay, and happy and satisfied. In the portion of the stomach that is removed, there is a specific area that produces your hunger hormone called ghrelin. That hunger hormone producing area is also removed. So the hunger is reduced, your cravings are reduced, and more importantly, we have noticed that your metabolic rate, that is the energy expenditure in your body, increases substantially. Okay. But after this procedure, like any other bariatric procedures, you have to be on a 6 to 8 weeks of specific diet that we will guide you. That's your recovery period, but there's no specific bed rest required. Right after the procedure, within 3-4 hours, you can get up, start walking, climbing stairs, etc. Can get back to work within a few days. If you have option of working from home, you can log in within 2 days also. There's a very good resolution of excess weight, diabetes, etc., and very low malnutrition. So we don't require a lot of supplements or anything like that. But there is ever so slightly, if you don't maintain, like any other procedure, there's a risk of weight regain. Gastric bypass is a very old procedure, been around for 25-30 years, where we reduce the size of the stomach. Also, we bypass the portion of the intestine at the bottom. Thereby, you get restriction on the food, also the malabsorption. The food that you consume, not entirely will get absorbed. Part of it will get excreted without getting absorbed. Same thing in the way we use our technology, 1 to 2 day hospital stay, hardly any bed rest. Same thing, within 2-3 days, you can get back to or work from home, or within a week, you can get back to work. Good resolution of diabetes can be expected in diabetics. Also, not a whole lot of weight regain happens, but it's possible. And that's considered to be a very good procedure, been around for a long time. But there are some newer procedures that came up, which are better than those, which is called sleeve plus methods. In sleeve plus method, again, it's about 2 hours procedure, 1 day hospital stay. Here, not only do we reduce the size of the stomach like a gastric sleeve, to the sleeve, then we attach the intestinal bypass. So thereby, advantage is, like a sleeve, you'll be able to eat a comfortable portion of food. Unlike in a gastric bypass, you can eat very small quantity. In a gastric sleeve, you can eat slightly better. And because there is intestinal bypass also at the lower area, the excess food, if any consumed, does not get absorbed. It can get excreted. So good weight loss, good resolution of diabetes, and very low chances of weight regain. All these benefits are there with the Sleep Plus methods. So let me conclude by last two slides. One is benefits of bariatric surgery. What we do notice is that almost 77% of the patients who are diabetics who walk through into our doors, they have resolved their diabetes. They're off their medications. We have taken away their oral medications, their insulin, everything is taken away. Okay. So in looking at the diabetes related deaths, a lot of people have infections, they have foot ulcers, they're leading to amputations, a lot of things happen. All that is reduced by 92%. High cholesterol levels are reduced by 70% in many patients, right? And in 70% of the patients, the cholesterol levels are normal. Now, in coming to high blood pressure, about 62% of the patients, they no longer require medications. Hypertension has resolved. Sleep apnea, very good success rate. We see that more than 86% of the patients no longer require any machines to support their sleep. They do not snore anymore, and their quality of life, quality of sleep is fantastic. Now, this is the important thing what we see, what happens immediately after the bariatric surgery. More than 93% of the people, we discontinue their medications for diabetes within 48 hours. And people who are taking insulin shots on a daily basis will be converted to just oral tablets within almost 99% of the times. And when it comes to high blood pressure, almost 82% of the medications are discontinued within 48 hours. So all these are the wonderful benefits of bariatric surgery. I just will show you a couple of results of our patients. So this is a young lady who was 118 kilos before. After 6 months, 83 kilos. This is a gentleman who was in his 40s, 149 kilos, had diabetes, hypertension, etc. But after 6 months, he dropped down to 95, and both the conditions, hypertension and diabetes, have resolved. And this is a doctor who himself had the procedure, extremely happy. He was 115 kilos and in 6 months became 85. And he actually makes his poster and gives it to all the patients by himself. So in conclusion, I would like to say that take the right step, take care of yourself, regain that health, regain that confidence, bring in that joy and happiness in your life back to you, which if it has been taken away by obesity, let's get a hold on that. Yeah. Thank you all very much for your patient listening.
Yeah, thank you, Dr. Nand Kishore.
Yeah,
I'll request Professor Adrian Kennedy to
Doc
answer.
NK.
Yes, sir.
Thank you. I had no idea whatsoever that the benefits of surgery, bariatric surgery, was so absolutely profound and so complete. I mean, I can't imagine. You mentioned that diabetes, which is normally referred to as a lifelong disease, 77% actually went off medication, and you subsequently gave a figure of 93%. Between 70 to 90% of individuals resolve diabetes, and diabetes is one of the big problems globally. Blood pressure, 62%. Cholesterol, 70 to 80%. Sleep apnea, 86%. I cannot for the love of me imagine why any of us should not seriously look at bariatric surgery. And sir, I may tell you this also. In your talk, again, absolute, I had no idea. It just goes to show you, here am I, a PhD, but so ignorant. I can't understand this. You spoke about endoscopic gastric balloon.
Yes.
1 year repetitive. And it was almost a daycare procedure. You spoke about sleeve gastric. Forgive my inability to use those to talk about those words. But you spoke about 2 days and 3 days of hospitalization and such profound impact. It's remarkable. And you know, at the end of your talk, you actually showed us, I mean, the proof of the pudding is in the eating. You actually showed us individuals who have managed to retain up to a 50 kg weight loss. Absolutely profound. I mean, it's unbelievable. Of course, you also mentioned about medication,
Yes.
15-25%. That's, I mean, we are so lucky to have these great remedies at this time. And none of this takes away from the earlier aspect of what you spoke about, which is continued management of diet and continued physical activity. You know, Doc, I also have to mention some of the frightening things that you said. Now, these things you speak about, the surgery aspect, etc., are beneficial. But look at the other aspects. Obesity. I couldn't for the love of me imagine that India, a developing economy with poor people, is the second largest country with our children is the second largest population of obese children.
Yeah, it's a
Very, very
fact.
informative. But I'm now going to ask you an opposite question, Doc.
Please.
And of course, that question relates to me and my family in many ways. I have a teenage granddaughter, and the problem is exactly the opposite of obesity. I mean, you know, I'm trying to look at my notes where I've made a note of that. And yes, you talk about fertility being reduced by 5% or early onset puberty and things like this. I mean, is it even correct to ask a bariatric surgeon about the effect of anorexia on children? With your profound knowledge, sir, I'm sure you can give me a little advice that I can carry through to my grandchild.
Absolutely. So while we are always talking today, entire day has been spent on overweight, excess eating, lack of physical activity. The other end of the spectrum is the bulimia and anorexia. This is a body, rather the physical appearance based disorders. A lot of young people, especially young ladies, they fall prey to this. They have a condition called body dysmorphic disorder. So they wish to be skinny, further skinny, and then very skinny, skinnier. So they will do anything that is possible to avoid weight gain and lose the weight that they have. So anorexia is a condition where a person almost eats nothing. They eat very, very, very little, barely enough. Almost, you can see there are a lot of public personalities also who go through, especially the movie personalities. We see them where they go through these massive diets and they look like severe patients. That's anorexia. There's another condition called bulimia. Bulimia is where a person eats a large quantity, gets into guilt, and they go ahead and do a self-induced vomiting. They vomit all the food. They go to the side and vomit. So these both conditions make a person lose weight, but that affects a lot on their psychological aspect. They become depressed, they become socially withdrawn, and most of these youngsters, they tend to lose their hair, have like very shriveled skin, very low on energy, protein energy, malnutrition, lack of muscle mass, and it's an unfortunate situation. What these youngsters require, should they get into this kind of situation, is that they need a serious psychological and psychiatric help. There are medications and therapies available today. And also parents need to be very supportive. They cannot be vindictive, they have to be supportive and making sure that they get through that segment. They probably will fight this battle for the rest of their lives for the most part, these youngsters, but It's our job to give them all the support that they require to get over that issue. Yeah.
You know, Doc, I unfortunately, I started with the end of your statement, with the end of your presentation where you spoke about the benefits of surgery. And I was so taken up with that.
Yeah.
But you know, right at the beginning of your presentation, you mentioned that obesity was a pandemic.
Yes.
And then you said it is a global challenge. And then you actually compared it with COVID and global warming. And we know that COVID, and we hear so much about global warming, you know, but you actually compared obesity with that. And you emphasized it, or you confirmed it by saying, and rightly so, that there is not a single city in the world that does not have obese people. Correct. You're absolutely right. You know, if ever, you know, Doc, I frequently, I know that cardiac surgeons are almost like movie stars when it comes to when it comes to our medical fraternity. I do know that we are very respectful and in awe of our neurosurgeons, and I do know that we frequently meet our orthopedic surgeons and things like this. I can't imagine. Here are our bariatric surgeons who are the remedy to one of the largest human challenges. If you talk about global warming, it is to do with the environment. But if you talk about obesity, it is to do with the individual human being.
Absolutely.
I have to thank you for your selection of career, Doc, number one. And I am so delighted that you are looking at steering the bariatric society in our country. You know, and your statement, your simple statement was, if you take care of obesity, and here is the rub, if you take care of obesity, you will take care of cardiac ailments, you will take care of diabetes and hypertension, you will take care of joint ailments, you will take care of sleep apnea, you will take care of cancer.
Absolutely.
Well done, well done, well done, well done. I'm embarrassed that I have no questions to ask because you have given us all the answers. But nevertheless, just a closing remark, sir, a closing remark. Give us your advice, your profound advice.
When it comes to overweight, obesity, my suggestion is that prevention is always better than cure. So if you can avoid getting to that frame of, or the body mass index of overweight, obesity, morbid obesity, thereby picking up diabetes, hypertension, etc., don't ignore, don't neglect so much. Take active role, be active, get the most out of your lives, be physically active, enjoy your food, but don't abuse the food, and be a guidance and a source of guidance for your next generation, because our generation is happening, but I think what's more scarier is that what's happening in the upcoming generation, in the Gen Z, etc. Obesity is becoming more and more prevalent. So prevention is better than cure. But should somebody already have this obesity and or associated conditions, not to ignore, not to neglect, take an affirmative action, whether it is physical activity, lifestyle, medication, surgery, does not matter. Take that affirmative step, get that conditions improved, managed, so that thereby the remaining life, you'll have wonderful quality in it. So that would be my advice.
You know, sir, I usually most of our surgeons are rather reclusive. You know, they are doing a splendid job, but they do not announce themselves. I have a request. I really have a request. With what you have said, I request that your continued social contribution must remain, because you seem to have a surgical solution for sure, but you seem to have a solution for society. And I think that is vitally important. No matter how much Coach Nadeem or I, as a lifestyle professional, talk to our community, the word of the doctor is the word of God. So you have to lead us, Dr. Nand Kishore, you have to lead us. And I request your continued association beyond surgery with a social movement to take care of obesity. Because not only, sir, will you be managing problems in adults, but you will actually be driving the future of our country through our children. And this is where your contribution can be so magnified. Forgive me for demanding of your time and asking you to continue with your social contribution, but we will be profoundly grateful, sir. Thank you so much, Dr. Nand Kishore. Coach Nadeem, I speak too much, so I hand over to you.
Thank you so much, sir. Thank you, Dr. Nand Kishore, for a very nice presentation. I wish Active Life and Live Life together, we can create a big impact in the society through weight loss challenges, through school wellness programs, and through many initiatives. So let us make India the healthiest India. As you know, we all know that India is progressing economically and everywhere, but only thing in health we are reducing. So let us do our bit in lifestyle as well as medical to create a healthy and active India. Thank you.
Absolutely. Couldn't agree more. Thank you. Thank you, Professor.
Thank you. Thank you, sir.
Have a good day.
Thank you.
You too, sir.